As we all know, tularemia is a bacterial zoonotic disease caused by Francisella tularensis. It is known that it's highly virulent for humans and a range of animals such as rodents, hares, and rabbits. It may cause epidemics and epizootics. Francisella tularensis is transmitted to human by arthropod bites, by direct contact with infected animals, by infectious animal tissues or fluids, ingestion of contaminated water or food, and inhalation of infective aerosols. Kosovo is an endemic zone for tularemia. Tularemia is a mandatory notifiable disease, and for the first time, we have faced with an outbreak of tularemia in 1999, 2000, with a totally 327 serologically confirmed cases of tularemia, while in 2001, 2002, we had totally 170 confirmed serological cases. The objective is to describe the outbreak and to identify the potential risk factors linked with an infection source and modes of transmission during a recent outbreak. As methods, we have, the study is descriptive. The case definition was, it's clinically compatible with a positive laboratory test for Francisella tularensis on serological results and an agglutination titer greater than 1 to 160. Data collection was made by using a face-to-face standardized questionnaire. We analyzed the potential risk factors linked with an infection source and modes of transmission, and as inclusion criteria, we have the family members of the living in the same household. We have done the attack rate and relative risk by univariate analysis and chi-square statistical significance testing. The surveillance data were analyzed by person, time, and place. 459 tularemia cases were registered in 21 out of 38 municipalities of Kosovo. No deaths occurred. Most of the cases were from the central and eastern part of Kosovo. 77.8% were from the rural areas. As we can see in the map, by the legend, you can see that the incidence higher than 100 per 100,000 population we have registered in the central part, and less than 10 we have registered in the southern and western part of the country. Regarding the tularemia cases by date of onset, we can see in the epicurve that the epicurve shows that the confirmed cases start to increase and peaks during December 2014 till March 2015. Regarding the distribution of the cases by age group, we can see that the age group from 0 to 14 has presented with totally 116 cases. But when we performed an age adjustment, we can see that the rate from the age group 35 to 44 is 37 per 100,000 population. The crude rate is 24.4 and the age-adjusted rate is 23.8. There was no difference between gender identified. It was almost equally. Regarding the tularemia cases by its clinical feature, we have figured that 94% of the confirmed cases presented with cervical lymphadenopathy, 84% of them with temperature, 72 of them sore throat, and also 2% of them had axillar and inguinal lymphadenopathy. Regarding the cases by potential risk factors, 379 or 82.6% of them reported that they have used well water, while 77 or 16% of them has used tap water, and 3 or 0.6 have been in contact with animals. Regarding the tularemia cases by exposure to the well water in Kosovo, we can see that those who were exposed to the well water had the attack rate 14.8, while there who were unexposed to the well water had the attack rate 6.8. The total attack rate was 12.4. We have calculated a relative risk too, and it's statistically significant. So those who were exposed to the well water are 2 times at higher risk of getting infection than those who were not exposed to the well water. Our limitations: no environmental samples were taken due to our lack of lab capacities, financial resources, and veterinarian services were not included. Conclusions: the population which is exposed to the well water are at higher risk of tularemia infection. The causality of the outbreak is challenging to interpret, but further studies are needed to address the importance of integrated surveillance system. Recommendations: improve access to the central water supply system, improve lab capacities, raise awareness among people living in rural areas and those who use well water, and integrated surveillance system in a concept One Health for controlling the rodents. And I'd like to thank to my supervisors and of course to you audience. Thank you.
Pranvera, thank you very much, and it is very important information with the presentation, and it reminds again that high quality drinking water, how is important for healthy of population. Now please, questions and comments. Okay, please.
Carmen Varela, ICDC. It's a bit striking, the number of cases is a very big outbreak, and I wonder, it seems to me that your hypothesis was actually completely linked to water, while in tularemia there are many other possible risk factors. And then you use a retrospective cohort study. Could you explain why you didn't choose a methodology of a case control, and if you have considered other factors?
When we analyzed the questionnaire, we couldn't find that there was a possible another way, meaning of food. And about the case control study, as you mentioned, we couldn't do that due to our financial sources.
Maybe you should explain now, tell us which possible risk factors you included in questionnaire. Maybe it's what important to say, if you included other possible risk factors.
Yes, of course, we included the storage of food, the contact with animals, their movement to the other countries, tick bites, of course. Yeah, we couldn't find in the questionnaire, there was no information.
Okay, next question.
Part-time Georgia, maybe I missed during the presentation, what was clinical manifestations?
Cervical lymphadenopathy. 94% of them. Yeah.
Okay, next question, comments?
Unilateral or bilateral.
Thank you, Pranvera.